Well, good afternoon, everyone, and welcome to our COVID-19 update briefing for Wednesday, October 28th. I'm joined today by Illinois State Police Director Brendan Kelly, who will provide an update from ISP on our election integrity support and our COVID mitigation enforcement. But first, our regular update. Today is the first day of additional mitigations in suburban Cook County and Metro East, with the City of Chicago following on Friday. And as of this morning, Region 9, Lake and McHenry counties has now sustained an average positivity rate of 8% or higher for 3 days, meaning that starting Saturday, they will join 7 of our 11 other regions in operating under resurgence mitigations. Region 9 is today seeing an 8.4% positivity average, up from 4.8% this time last month, and up from 3.1% in late June. Average COVID-related hospital admissions today are 5 times as high as they were in mid-June and 3 times as high as in mid-September. In other words, things are bad in Region 9 and getting worse. So beginning on Saturday at 12:01 a.m., public gatherings in Lake and McHenry counties will be reduced to 25 people, and indoor dining and indoor bar service will be temporarily closed, although outdoor service in tents or tented igloos and takeout, delivery, and drive-through service will remain available. We have made $220 million of business interruption grants available to any affected business. Applications for those grants for those businesses that are affected by these new mitigations are available on an expedited basis on our Department of Commerce website at dceo.illinois.gov. These resurgence mitigations aim to cut down on some of the highest risk activities until we bring down the positivity rate in Region 9 once again. As for Regions 2, 3, and 6 that remain free of resurgence mitigation measures, Region 3, which encompasses Quincy, Springfield, and much of west central Illinois, has now seen 2 days in a row of a positivity rate reaching 8%, meaning that the third day, tomorrow, would equal mitigations beginning in the region over the weekend if that happens. Region 6, east central Illinois, today has seen its first day above 8%, and if the trend continues, the area can expect the same mitigations as its surrounding regions. Region 2, which stretches from Kendall to Rock Island County and includes Peoria, is today at an average positivity rate of 7.7%, up from 7.2% on Monday. I know this virus is very hard on everyone. The damage COVID-19 is doing to people's lives and livelihoods is real. And for many people, the fight has gotten harder as the months have passed. Despite what the stock market looks like, the real economy for real people has been brutalized by this virus. And the Republican-controlled United States Senate has refused time and time again to give workers and those unable to work and local governments and small businesses the kind of support that they need. Many cannot financially survive this pandemic without help from Congress and from the President. The same, of course, is true about the health of Illinoisans. If we aren't able to bring down the number of cases and the rate of transmission, not only will our economy continue to suffer, but many more people will be hospitalized. Some will end up with long-term health consequences, and too many will die. This battle isn't going away by itself. We have to manage our way through with tools that we have available to us. And there are many of those tools that nearly everyone in our state has available to them to join this fight. First and foremost, to stay healthy, You should be wearing a mask when you are with people that are not in your personal family pod. Keep 6 feet of distance from others, even when you're wearing a mask, and frequently wash your hands. With the virus on the rise, you can stay safe by avoiding unnecessary gatherings. Don't host parties or attend them. It's hard, I know, but your home is only as safe as the people that you bring into it and your confidence that they've been wearing their masks and have been following the rules to stay safe. I have always maintained enormous faith in the people of Illinois to do what's right for each other. Our state government has always relied first and foremost on educating people about the dangers of the virus and about the rules to maintain public health. State Police Director Kelly and Public Health Director Dr. Ezike would say the same thing I just said. From the beginning, we have used encouragement and education to get businesses to follow the best public health guidance of our time. When a region is seeing seriously concerning rates of community spread, temporarily halting indoor, in-person eating and drinking operations has been best practice, not just here, but around the world. Why? Because the scientific research proves that these are the activities that frequently cultivate exposure and spread. The Centers for Disease Control and Medical Research have made that clear. So far, the Illinois State Troopers have worked hard to educate people about safety measures in dozens of counties across Illinois, working with local law enforcement, public officials, and health departments to urge the compliance that we need in order to get things under control so that we can, in fact, resume more normal operations once it's safer. But as we've unfortunately learned during this pandemic, some business owners refuse to get educated or just don't want to follow the rules, thereby putting their patrons, the public, and their workers in danger. Sometimes educating people isn't enough to get them to do the right thing. The state police have ramped up random checks of businesses that are subject to mitigation rules to identify those that aren't following them, and they've begun progressively taking more stringent action to hold scofflaws accountable. Director Kelly will talk about what that looks like in just a few minutes, and I've asked Liquor Control Commission and the Gaming Board to do the same. Local officials have a responsibility in this work as well. They are obligated to take action to keep their communities safe and to carry out the laws and regulations that are on the books. When state and national public health experts and their own local public health departments tell them things in their city, their town, and their county are getting bad, that more people will get sick and die if they don't take action, their job as a local elected or appointed leader is to lead, no matter how loudly a minority of people may criticize them, no matter how big a personal challenge that may be. Indeed, most often that's what separates good leaders from bad ones. The people of our state and our responsible business owners in our state rely upon local leaders to enforce public health guidance and hold bad actors accountable. Although I could rattle off a whole list of the incredible local leaders who have stepped up over the last 8 months to do the right thing to keep their fellow Illinoisans safe, there are also plenty of examples of local officials setting a bad example, refusing to believe the science and misleading their constituents. Getting beyond this pandemic, getting more kids into classrooms, and keeping our businesses open isn't going to happen sooner or safely if leaders are ignoring the virus or telling people they don't need to wear a mask or hosting gatherings that can turn into super spreading events. That's not leadership. With that, I'd like to turn it over to a great leader and someone that I'm very proud to work with, Dr. Ngozi Ezike. Doctor.
Thank you so much, Governor. Good afternoon, everyone. Today we are reporting 6,110 new cases of COVID-19. And that report, we also have over the last 24 hours, 51 additional deaths reported to IDPH. To date, 389,095 total confirmed cases have been reported in Illinois, and 9,619 total deaths. In the hospital overnight with COVID-19 were 2,861 individuals. Of those, 600 were in the ICU and 243 were on ventilators. In the last 24 hours, 70,752 tests were reported for a total of 7.4 million tests. I would like to give yet another shout out to our hardworking local health departments. It is our local health departments that are on the front lines, tracking cases in their jurisdiction, investigating outbreaks, and supporting individuals who have indeed tested positive. These dedicated staff are working around the clock to protect all of us. And one of the ways they are protecting us is by enforcing the mask mandate and an emergency amendment to the Control of Communicable Disease Code. That amendment calls for a notice of noncompliance to be issued to a business if they are in fact in violation of the masking requirement. If the businesses do not comply, it is then subject to penalties. Local health departments are also supporting law enforcement who are working to enforce the mask mandate as well. My hope is that enforcement is not needed because people will know that wearing a mask is the smart thing to do, it's the responsible thing to do, and that it will save lives. People talk about a mask mandate infringing on their rights, but I'd have to ask, do you have the right to put the health of others at risk? You don't have the right to spread a potentially deadly virus simply because you don't want to wear a face covering. But until people step up and take responsibility, I would like to ask for you to please help our local health departments by following the mitigation measures and following the mask mandate. Like it or not, we are all tied together. We are in this together, and we get through it or not together. We will get through this, so let's work together now.